But first, we do want to begin today with a disturbing finding in some younger patients with this COVID-19 coronavirus. New study says it could have deadly consequences. We talked to the team at Mayfield Brain and Spine about it, as well as women's health provider Dr. Amy Brenner. We want to share how this rare but dangerous discovery in blood clots could raise the stroke risk.
I'm going to take your temperature. Okay.
There are many reasons some patients have still needed in-person visits in this COVID-19 crisis with gynecologists. But now Dr. Amy Brenner says there may be one more.
Many gynecologists prescribe medications that already increase the risk of blood clots, such as birth control pills, oral estrogen. So those medicines we already know increase the risk of clotting. And we also know that this COVID-19 is doing some weird things to the clotting system.
In fact, a new study about to be published from multiple medical centers shows the virus could raise the risk for stroke in younger people due to blood clots that can form anywhere in the body. Dr. Andy Ringer of Mayfield Brain and Spine and Ohio's TriHealth Neuroscience Institute told me it is likely due to one of two things.
Is it because COVID is creating blood clots in these patients and causing them to have the strokes? That part's not quite so clear. It's really hard to draw conclusions like that on a small number of patients. However, the other phenomena that's also brought up in the same study is the question about delayed presentation. We're seeing about, on average, 2-hour delay in presentation compared to the same time last year.
So possibly here there's a broader message. If I am having a stroke, are there common symptoms?
The classic warning signs for stroke, we call them FAST, face, arm, speech, time to call 911.
And even if you feel it's not urgent, this reminder today from women's health provider Dr. Amy Brenner.
Should something be done to possibly mitigate that risk of clotting?
Well, of course, that's a very good question, and we do want to share a little healthy perspective on this today. This delayed care has really been a sort of recurring theme for the past several weeks. The American Heart Association just issued a report which says there's been a big drop in the numbers of both heart attacks and strokes reported. Much of it is because some patients are not seeking care because they're simply afraid to go to the hospital, and they're afraid they'll catch this virus if they do. But it's also because many of us would rather ignore symptoms, they say, at times rather than acknowledge them. Here's what Dr. Andy Ringer had to say about that FAST syndrome he talked about. You heard him mention it was face, arm, speech, and time.
A drooping of one side of the face, slurring or abnormal sounding speech, and arm weakness that causes one arm to be weaker than the other side. Any of those are an emergency condition that might be a warning sign for stroke. And whether you are aware that you have risk factors for stroke or not, or that your loved one does, if you see these signs, it is still time for an emergency, even in young, healthy individuals.
So, quick reminder in all this, since those are often things that a person cannot notice themselves, there's probably never been a time where it's more important for all of us to pay attention to those we love. If someone that you love is having these symptoms, don't let them off on the idea that they're just fine. Call 911 for them. Emergency responders do want these calls right now, and so do healthcare providers. And one other thing to mention in all this is that there's also been an interesting trend in coronavirus deaths. It seems to hit both men and women at equal rates, but it appears to be more deadly in men than in women, according to a study in the Journal of the American Medical Association. There are several theories as to why. It may be that women are able to better fight off this infection, but we also know that guys have a tough time admitting that they need medical care. They're more likely to delay care with many health problems, heart risk, stroke, perhaps even the coronavirus. So just a note, we all need to sort of be looking out for each other right now. Don't delay care for heart symptoms or concerns about COVID-19. The one clarity that we're getting in all this, or in all about these numbers, is that symptoms are simply observations, but they can be very different for everyone. And delaying care for heart attacks, for stroke, for COVID-19, as we've seen with all of these illnesses, time matters. For example, just when it comes to stroke, what a few hour difference could make?
A couple hours makes a huge difference. On average, that can make a 20 to 30% or greater difference in the likelihood of surviving your stroke.
You know, survival is fragile. Life is fragile, especially right now. And it is a tragic time to lose a life anytime, but to lose a life that we could save because someone doesn't seek care, because we want to be a tough guy or girl, or because we're afraid of going to a hospital even though there's a very low risk of catching COVID-19 there, that is a double tragedy. And that is today's Healthy Perspective. We'll be right back.